Are you unknowingly eating foods that could be harming your prostate right now? What if some of your favorite snacks are silently making prostate problems worse? In this video, we're diving into the worst foods that damage prostate health and how to spot them before it's too late. Stay tuned because the truth about these common foods might surprise you and could change the way you eat forever. First, we have caffeine. Caffeine is one of the most widely consumed psychoactive substances in the world, found in coffee, tea, energy drinks, and even some medications. While many people rely on it to boost alertness and energy, caffeine can have some negative effects on the prostate, especially for men who already have prostate issues like benign prostatic hyperplasia, BPH, or prostatitis. One of the main problems with caffeine is its ability to act as a diuretic, which increases urine production and can lead to more frequent urination. For men with an enlarged prostate, this can worsen urinary symptoms such as urgency, frequency, and nocturia, waking up at night to urinate, making the condition more uncomfortable and disruptive to daily life. Caffeine stimulates the nervous system, which can cause the muscles in the bladder and prostate to become more tense or irritable. This heightened muscle activity around the prostate can increase pressure on the urethra, the tube that carries urine from the bladder out of the body. When the urethra is compressed, it slows down urine flow and causes the bladder to work harder to push urine out. This extra strain can worsen the symptoms of prostate enlargement and lead to bladder irritation. Additionally, caffeine can cause inflammation and irritation in the urinary tract, which might exacerbate existing prostate inflammation and discomfort, prolonging recovery or worsening chronic prostate conditions. Another significant impact of caffeine on prostate health relates to its acidic nature. Drinks and foods with caffeine, like coffee and some sodas, tend to be acidic, which can irritate the lining of the bladder and prostate. This irritation often leads to increased bladder sensitivity and discomfort, which is already a common complaint in men with prostate issues. This acidic irritation can trigger more frequent urges to urinate and cause a burning sensation, creating a cycle of discomfort that can be difficult to break. For men dealing with prostatitis, which is the inflammation of the prostate gland often caused by infection or irritation, caffeine's irritant properties may make symptoms much worse. However, not all effects of caffeine on the prostate are harmful. Some studies suggest that caffeine has antioxidant properties that may help protect cells from damage caused by free radicals. Free radicals are unstable molecules that can harm cells and contribute to chronic inflammation and possibly prostate disease. In this way, moderate caffeine intake could offer some protective effects against oxidative stress, which is linked to many chronic diseases, including prostate problems. The antioxidants in coffee, for example, have been studied for their potential to reduce the risk of certain cancers, including prostate cancer, though the evidence is still evolving and somewhat mixed. Additionally, caffeine has been shown to have some anti-inflammatory effects, which might be beneficial for prostate health in certain situations. Low to moderate caffeine consumption may help reduce markers of inflammation in the body, potentially offering relief for men suffering from chronic inflammation of the prostate. However, these benefits seem to be dose-dependent. Too much caffeine intake tends to flip the effect, increasing inflammation and irritation instead. So, moderation is key when considering caffeine's potential benefits for prostate health. Next, we have lemons. Lemons are often praised for their health benefits due to their high vitamin C content and antioxidant properties. But when it comes to prostate health, their effects can be a bit more complicated. Lemons are highly acidic, and this acidity can sometimes cause irritation in the urinary tract and bladder, especially for men with pre-existing prostate conditions such as benign prostatic hyperplasia, BPH, or prostatitis. This irritation can lead to increased discomfort during urination, a symptom that many men with prostate problems already struggle with. The acidic nature of lemon juice can worsen bladder sensitivity and inflammation, making symptoms like urgency, frequency, and burning sensations more pronounced. For men dealing with prostatitis, which is inflammation of the prostate gland, the citric acid in lemons can aggravate the condition. Prostatitis symptoms often include painful urination and pelvic discomfort, and consuming acidic foods or drinks like lemon juice may intensify this pain. Acidic urine caused by lemon consumption can irritate the lining of the bladder and urethra, which passes through the prostate, creating a feedback loop of irritation and inflammation that worsens the overall prostate health. This makes lemon juice a potential trigger for flare-ups in men suffering from chronic prostatitis or interstitial cystitis. Additionally, lemon juice is a natural diuretic, meaning it increases urine production. While this can be beneficial in some cases by flushing out the urinary tract, for men with an enlarged prostate, this increased urination can exacerbate symptoms like frequent urination and nocturia, waking up multiple times at night to urinate. The frequent need to urinate can be highly disruptive to sleep and daily activities, reducing overall quality of life. Moreover, the irritation caused by lemon's acidity, combined with frequent urination, can cause a cycle of discomfort and urgency, making it harder for the bladder to relax and function properly. However, lemons are also packed with vitamin C and flavonoids, which are powerful antioxidants. Antioxidants help combat oxidative stress, which is linked to inflammation and tissue damage in the prostate. In moderate amounts, these antioxidants could potentially reduce inflammation and support overall prostate health. Vitamin C is known to boost the immune system and has been studied for its role in reducing chronic inflammation, which is a contributing factor in many prostate disorders. This means that while lemon juice can irritate the prostate and bladder in some cases, it might also offer some protective benefits when consumed wisely and in moderation. Lemon peel contains compounds such as limonene and flavonoids that have shown anti-inflammatory and anti-cancer properties in laboratory studies. These substances may help slow the growth of abnormal prostate cells or even reduce the size of an enlarged prostate in some cases. Limonene, for example, has been researched for its ability to fight cancer cells and reduce inflammation. These potential benefits suggest that whole lemons or lemon extracts might have some positive effects on prostate health, although more research is needed to understand the full impact and appropriate dosages. The pH level of lemon juice, despite its acidic taste, can have an alkalizing effect once metabolized by the body. This alkalizing property can help balance body pH and might reduce the risk of certain urinary tract infections, which can indirectly affect prostate health. A balanced pH can create a less favorable environment for bacteria that cause infections, potentially reducing prostate inflammation caused by infections. However, this effect depends greatly on an individual's overall diet and health status, meaning lemons are not a cure-all, but rather one small factor in a larger health picture. For men with sensitive bladders or those prone to urinary tract irritation, the sharp acidity of lemons may outweigh any potential benefits. Regular consumption of lemon juice or lemon-based drinks may keep the bladder and urethra in a constant state of irritation, prolonging symptoms like burning or discomfort during urination. This is particularly true if lemons are consumed in concentrated forms, such as undiluted lemon juice or lemon-based soft drinks, which deliver a high acid load directly to the urinary tract. Hydration also plays a critical role in how lemons affect prostate health. Drinking lemon water diluted with plenty of water can help flush toxins from the urinary system and prevent dehydration, which might reduce irritation. However, concentrated lemon juice without sufficient water intake can increase acidity in the bladder and worsen symptoms. Proper dilution is key to minimizing the harmful effects of lemon's acidity while taking advantage of its antioxidant properties. Next, we have sugary snacks. Sugary snacks are a staple in many diets worldwide, often consumed for quick energy and taste satisfaction. However, when it comes to prostate health, these treats can cause more harm than good. Excessive sugar intake contributes to systemic inflammation, which is a key factor in worsening prostate conditions such as benign prostatic hyperplasia, BPH, and prostatitis. Chronic inflammation caused by high sugar levels can irritate prostate tissue, leading to swelling, discomfort, and exacerbation of urinary symptoms, like urgency, frequency, and difficulty in urination. This inflammation can also make the prostate more sensitive and vulnerable to infections, prolonging recovery and increasing the risk of chronic prostate problems. High sugar consumption impacts insulin and blood sugar regulation, leading to spikes and crashes that negatively affect hormone balance. Insulin resistance, often caused by frequent sugar intake, can disrupt the delicate hormonal environment necessary for a healthy prostate. This hormonal imbalance may contribute to the development or worsening of prostate enlargement by promoting abnormal cell growth within the gland. Elevated insulin and related growth factors encourage proliferation of prostate cells, worsening BPH and increasing prostate size, which in turn worsens urinary symptoms. Sugary snacks often come with high levels of refined carbohydrates and unhealthy fats, which can exacerbate oxidative stress in the body. Oxidative stress damages cells by generating free radicals, which are harmful molecules that can trigger inflammation and contribute to cellular degeneration. In the prostate, this oxidative damage can accelerate tissue inflammation and deterioration, increasing the likelihood of developing or worsening prostate diseases. The combination of sugar and unhealthy fats in many processed snacks amplifies these negative effects, creating a toxic environment for prostate cells. Another concerning factor is that sugary snacks contribute to obesity and metabolic syndrome, both of which are strongly linked to poor prostate health. Excess body fat, especially around the abdomen, increases the production of inflammatory chemicals called cytokines, which aggravate prostate inflammation and may promote prostate enlargement. Obesity also alters hormone levels, increasing estrogen and decreasing testosterone, which can negatively impact prostate function. Men who consume excessive sugary snacks are more likely to gain weight, putting additional strain on the prostate and worsening symptoms related to enlargement and inflammation. Despite the many harmful effects, sugary snacks themselves do not contain any properties that directly shrink the prostate or improve its health. Unlike natural foods rich in antioxidants, vitamins, or anti-inflammatory compounds, sugary snacks generally lack any nutrients that could benefit the prostate. They are essentially empty calories that provide energy but no protective substances, and their overconsumption can undermine prostate health by fueling inflammation and hormonal imbalances. In contrast, some ingredients often found in healthy foods but absent in sugary snacks, such as antioxidants, fiber, and polyphenols, play a role in reducing prostate inflammation and potentially shrinking an enlarged prostate. Antioxidants help neutralize free radicals and reduce oxidative stress, protecting prostate cells from damage. Fiber supports healthy digestion and helps regulate blood sugar, preventing insulin spikes that contribute to prostate growth. Polyphenols, found in fruits and vegetables, have anti-inflammatory properties that can calm prostate tissue and reduce swelling. Another indirect way sugary snacks worsen prostate health is through their impact on immune function. High sugar intake suppresses the immune system, reducing the body's ability to fight infections, including those that can cause or worsen prostatitis. A weakened immune system may lead to prolonged infections or increased inflammation in the prostate, making symptoms more severe and recovery slower. This immunosuppressive effect of sugar can be particularly harmful to men already dealing with chronic prostate conditions. Next, we have trans fats. Trans fats, also known as trans fatty acids, are artificially created fats found in many processed foods, fast foods, and baked goods. These fats have been widely criticized for their detrimental effects on cardiovascular health, but their impact on prostate health is equally concerning. Trans fats contribute to systemic inflammation throughout the body, including the prostate gland, which can worsen conditions such as benign prostatic hyperplasia, BPH, and prostatitis. Chronic inflammation caused by trans fats leads to irritation and swelling in prostate tissues, exacerbating urinary symptoms like urgency, frequency, and difficulty in urination, all of which reduce quality of life for affected men. The consumption of trans fats is strongly associated with increased oxidative stress, a state where harmful free radicals overwhelm the body's antioxidant defenses. Oxidative stress damages prostate cells by breaking down cell membranes and DNA, accelerating tissue degeneration and inflammation. This damage sets the stage for prostate enlargement and may even increase the risk of prostate cancer over time. By contributing to this oxidative imbalance, trans fats create an unfavorable environment that worsens prostate health rather than supporting recovery or shrinking of the gland. Hormonal disruption is another critical factor influenced by trans fat intake. Trans fats can alter the balance of sex hormones by increasing estrogen levels and reducing testosterone production. Since testosterone plays a vital role in maintaining prostate health and regulating cell growth, its imbalance can promote abnormal enlargement of the prostate gland. Elevated estrogen levels can also encourage prostate tissue growth and inflammation, further aggravating symptoms of BPH. Therefore, diets high in trans fats can push hormonal levels in a direction that worsens prostate enlargement. Trans fats also negatively affect blood vessel health by promoting the buildup of plaque and reducing blood flow. Impaired circulation limits the delivery of oxygen and nutrients to the prostate, which is essential for tissue repair and healthy function. Poor blood flow can hinder the body's natural ability to heal prostate inflammation and may contribute to the progression of chronic prostatitis. Furthermore, reduced vascular health can lead to erectile dysfunction, a condition often associated with prostate problems, compounding the overall impact of trans fats on male reproductive health. Despite their many harmful effects, trans fats do not possess any known properties that can shrink the prostate or improve its health. Unlike healthy fats found in sources such as olive oil, nuts, and fish, trans fats provide no beneficial compounds like omega-3 fatty acids or antioxidants. Instead, trans fats are purely damaging substances that fuel inflammation, hormonal imbalance, and oxidative stress, all of which contribute to the worsening of prostate conditions. On the other hand, replacing trans fats with healthy unsaturated fats can promote prostate health. Unsaturated fats, particularly omega-3 fatty acids, have anti-inflammatory properties and can help reduce swelling and pain in the prostate. They also support hormonal balance by improving testosterone levels and reducing estrogen dominance. These beneficial fats aid in protecting prostate cells from oxidative damage and promote better blood flow, creating an environment more conducive to shrinking an enlarged prostate or maintaining a healthy gland. Trans fats also suppress the immune system by impairing the function of immune cells that fight infections and inflammation. A weakened immune response can make it harder for the body to combat bacterial prostatitis or viral infections that worsen prostate inflammation. This immune suppression caused by trans fats prolongs recovery time and increases the risk of chronic prostate inflammation, which can lead to persistent pain and urinary issues. Another indirect effect of trans fats on prostate health is their role in promoting obesity and metabolic syndrome. Excessive intake of trans fats contributes to weight gain and fat accumulation around the abdomen, which is linked to increased levels of inflammatory cytokines. These inflammatory chemicals intensify prostate inflammation and may accelerate prostate enlargement. Additionally, metabolic syndrome disrupts insulin and hormone regulation, further harming prostate tissue and exacerbating symptoms. Dietary habits rich in trans fats often correlate with poor overall nutrition, including low intake of fruits, vegetables, and fiber, all of which are essential for prostate health. A diet lacking in these nutrient-dense foods deprives the prostate of antioxidants, vitamins, and minerals needed to combat inflammation and support cell repair. Without these protective nutrients, the prostate is more vulnerable to damage and less able to shrink or recover from enlargement and inflammation. Last, we have white bread. White bread is a common staple in many diets, but it carries hidden risks for prostate health that many people don't realize. Made primarily from refined flour, white bread is stripped of most of its fiber, vitamins, and minerals during processing, leaving behind a product high in simple carbohydrates and low in nutritional value. When consumed frequently, these simple carbs cause rapid spikes in blood sugar levels, which trigger insulin surges. Elevated insulin levels promote inflammation and hormonal imbalances, both of which can worsen prostate conditions, such as benign prostatic hyperplasia, BPH, and prostatitis. This inflammation leads to swelling and irritation of the prostate gland, exacerbating urinary problems like frequent urination, urgency, and discomfort. The lack of fiber in white bread also negatively impacts prostate health by contributing to poor digestion and irregular bowel movements. Fiber plays a crucial role in detoxifying the body and maintaining a healthy gut microbiome. Without sufficient fiber, waste and toxins can accumulate, increasing systemic inflammation. Since chronic inflammation is a key driver of prostate enlargement and pain, diets rich in low-fiber foods like white bread can indirectly promote worsening prostate symptoms. Moreover, poor gut health associated with low fiber intake can impair the immune system, making the body less effective at managing infections and inflammation within the prostate. White bread's high glycemic index is another factor that contributes to prostate problems. Foods with a high glycemic index cause quick spikes in blood sugar followed by sharp drops, which create a cycle of energy highs and lows. This roller coaster effect stresses the body's metabolism and can lead to insulin resistance over time. Insulin resistance is linked to increased growth factor production that encourages abnormal prostate cell growth, contributing to enlargement. Hormonal imbalances caused by this metabolic dysfunction further aggravate prostate tissue, making urinary symptoms worse and potentially increasing the risk of chronic prostate diseases. In addition to metabolic and inflammatory effects, white bread consumption is linked to weight gain and obesity due to its low satiety and high-calorie nature. Excess weight, especially around the abdomen, is known to increase levels of inflammatory chemicals in the body. These inflammatory markers can directly impact the prostate, promoting swelling and further enlargement. Obesity also disturbs hormonal balance by increasing estrogen and lowering testosterone, a hormone essential for prostate health. This hormonal shift worsens prostate enlargement and inflammation, making symptoms more severe for men consuming large amounts of white bread regularly. White bread contains very little in terms of beneficial compounds for prostate health. It lacks antioxidants, vitamins, and minerals necessary for reducing inflammation and supporting cell repair. Unlike whole grains, white bread does not provide nutrients such as selenium, zinc, or vitamin E, which have been shown to play roles in prostate health. This absence means white bread does not contribute to shrinking the prostate or improving its condition. Instead, it deprives the body of essential nutrients that could protect the prostate and reduce the risk of enlargement. Conversely, whole grain breads and foods that contain bran, germ, and fiber have properties beneficial to prostate health. These foods are rich in antioxidants and phytochemicals that reduce oxidative stress and inflammation within prostate tissue. Fiber in whole grains aids in maintaining a healthy gut, which indirectly supports immune function and reduces systemic inflammation. These properties can help calm prostate swelling and may contribute to shrinking an enlarged prostate over time, in stark contrast to the effects of white bread. Frequent consumption of white bread can also contribute to impaired immune function, which affects the prostate's ability to fight off infections. Since prostatitis is often caused or worsened by infections, a weakened immune system allows bacteria or viruses to persist longer in the prostate gland. This prolongs inflammation and pain, worsening the overall condition. By contrast, diets rich in nutrients from whole foods help maintain a robust immune system, supporting faster recovery and reduced inflammation in the prostate.